Good morning, ladies and gentlemen. If you could take your seats, that would be quite good. And can I encourage people not to sit on the end of the rows? There's been some sessions this morning that were very full. I don't think we're going to completely fill the room, but people do come and go. And if you were sitting on the end of the rows, then they can't sit down and sort of dodge in and out of the session. So if you're sitting on the end of a row, maybe move in a little bit, certainly if you instead tend staying through the session. Can I also ask people to turn off their mobile phones and to just check where the exits are in case of emergency? From what I can see, they're all at the back, so just if the fire alarm goes off, head that way. I should be the last one out of the room because I'm at the wrong end for the fire exits by the look of it. We have 5 presentations in this session, each in 15-minute slots, all from North America, I think. So you've got an English chairman and an American lineup of speakers, or people from all working in the US anyway. I don't intend spending any time really introducing speakers. I think they could introduce themselves and spend as much time as is appropriate talking about the science rather than who they are and where they're from. So that's kind of my approach to this, and we will take as many questions as we have time for within each slot. So that's how I intend to chair the session. And without any more ado, I think we'll make a start with our first presentation.
So, good morning, ladies and gentlemen. So, the topic of the talk will be the treatment of bovine respiratory disease in juvenile calves with a single administration of a combination of florfenicol plus flunixin meglumine. So, this is a product that is called Resflor, and Resflor, so this is a combination of this NSAID and this antibiotic. So the objective of the study was to test and to evaluate the efficacy and the safety of Resflor in juvenile calves less than 6 weeks of age, so it means pre-ruminant calves. That was a multi-centered clinical field trial. We enrolled 9 sites in Belgium, France, and Spain, and the farms enrolled in that study were typical veal commercial operations in Europe. So the study was conducted according to the GCP, so the good clinical practice. The study was randomized, controlled with a positive product. The control product was Nuflor. Nuflor, this is an antibiotic, florfenicol, and you have to know that Resflor is a combination of an anti-inflammatory flunixin and this antibiotic florfenicol. So we can consider that Nuflor is a negative control to flunixin because the product does not include flunixin. The study was a full mask. With a design investigator dispenser. It means that the investigator evaluated the clinical parameters without knowing the treatment assigned, and the dispenser administered the product. There were no data transmission that occurred between the investigator and the dispenser. So here, these are the criteria that animals has to be to meet to be included in the study. So first, a depression score that was equal to 2 or superior. So a depression score of 2 was qualified as moderate. So the animal was isolated, head down, show muscle weakness, and had some delay in response. And the score 3, so severe, was the moderate depression with, in addition, the presence of ataxia, gnawing, eye stools, salivation, lacrimation, and some other signs. Together with this depression score, the animal must have a respiratory character score of 2 or more. So we had 4 different clinical signs for the respiratory disease: polypnea, dyspnea, cough, and mucopurulent nasal discharge. So each sign, each of the respiratory signs count for 1 point, and we have added these points to give a global respiratory score. And the depression score of 2 or more and respiratory score of 2 or more added with a rectal temperature of 40.3 degrees or above were the criteria to be included in the study. Here you have the treatment design, so the study design. So the calves were enrolled at 0 hour. Just after, they were allocated to the treatment group with Resflor or Nuflor. Both products were injected subcutaneously. We have observed and measured the clinical parameter, the clinical signs during all the study up to day 10, and we have defined 3 time points to evaluate the success, the efficacy of the product at 6 hours after treatment, at day 4, and at day 10. So we enrolled in that study 236 animals, and over this amount of animals, 210 animals were suitable for statistical analysis, 106 in res floor and 104 in new floor. We had mainly pure breeds and some crossbreeds. We had 199 males non-castrated and 11 females. The animals were aged of between 12 days and 41 days, so they were pre-ruminants, and the body weight ranged between 31 to 78.6 kilograms. So here, the product is dedicated to treat the bovine respiratory disease. We are in natural condition on the field, on farms, and so we needed to characterize the outbreak of this bovine respiratory disease. So we have collected nasal swabs, 236 nasal swabs. We have cultured the bacteria from these nasal swabs, and we have seen that Pasteurella multocida and Mycoplasma bovis were the most prevalent in this BRD outbreak. We have isolated also Mannheimia, Hemolytica, and Histophilus somni. Now going into the results, so the first things that we wanted to show, at least to evaluate, is the decrease of the temperature. So this is a variable that shows the efficacy of the NSID. And we have seen that res floor was able to decrease the temperature significantly 6 hours after treatment. So we had a drop of -1.36 degrees in comparison with Nuflor, that is only the antibiotic, with a drop of -0.6 degrees. So Resflor was better than Nuflor to treat the antipyrexia at 6 hours after treatment. Now looking to the clinical signs, we have evaluated also the respiratory health condition of the animal, and for this, at 6 hours, you can see that both treatment, Resflor and Nuflor, were able to improve the respiratory signs, the respiratory condition of the animal 6 hours after treatment. So we had here mainly 2, 3, or 4 clinical signs for the respiratory disease, and there was a drop here with 0 or 1 score. So the majority of the animal presented no respiratory signs or 1 respiratory signs after 6 hours. The same pattern has been observed for the general health conditions. So both products were able to improve the general health condition of the animal after 6 hours, with a large majority of the animal 6 hours after treatment that show a normal condition or a very mild depression. We have also observed the results of, we have also evaluated the efficacy of the treatment at day 4 and day 10. So here we were looking for the treatment success, the overall treatment success. So an animal were defined as treatment success if there was no depression, so the animal was in a good condition, good health condition, and a respiratory score of 1 or less, so no respiratory signs or at least 1 kind of respiratory signs, together with a rectal temperature that was below 40 degrees. And you can see that at day 4, in Resflor, we had 93% of the animal that were considered as a treatment success, and in Nuflor, 90%. For day 10, the treatment success was a bit lower. It was 78% in Resflor and 70% of Nuflor. So you can see that both products were really effective to treat the bovine respiratory disease, as it is shown here with the treatment success rate. We had also a look, obviously, to the safety. and especially also to the injection site reaction. So here the analysis included all the 236 animals included in the study, and you can see on the graph that the incidence of the injection site reaction was low in both groups. We also had a look to the pain at injection for the with the product, and we have seen that a large majority of animals didn't show any signs of pain of injection, and we also observed that there was a very low incidence of soft faces or related events for the whole study. And when there was these soft faces, they were transient and they were resolved prior to the end of the study and without any concomitant treatment. So you have seen that we have isolated a lot of bacteria, and we did also work to monitor the susceptibility of this bacteria to florfenicol, and we have cultured 378 isolates during the whole study, okay? And these isolates were tested with MIC, and you can see here that all isolates were found susceptible to florfenicol, so there was no resistance to florfenicol for Pastorella, Manemia, Histophilus somni, Mycoplasma bovis, and the Mycoplasma subspecies. So to summarize the results that I presented, we can conclude that Resflor was effective in reducing the temperature. We have seen that there was a drop of minus 1.36 degrees 6 hours after treatment. We have seen also that Resflor and Nuflor were effective to improve the clinical signs. So the general conditions, so the general health of the animal and the respiratory signs were improved similarly over the time. And these results were highly significant at 6 hours after treatment. And finally, the safety. So we have shown that Resflor and Nuflor were very well tolerated in this field study. So the general conclusion is that this study demonstrated that a single administration of Resflor, so the combination between flunixin and florfenicol, can be used successfully to treat respiratory disease with Manemia hemolytica, Pastorella multocida, Histophilus somni, and Mycoplasma bovis. And the main scope also of that study was to show that Resflor was safe to be used in juvenile calves less than 6 weeks of age, so safe in pre-ruminants in Ville's calves. Thank you.
Thank you very much. I think we've got time for one question. If people asking questions could state their name and affiliation and wait for the microphone, please, before speaking. Thank you.
Yeah, Damien Achard, thank you for your presentation. What would be the relevance of a decrease of the temperature, to your opinion, even if there is no difference in success rate at day 4, I think? So could you comment on how relevant it is to have chosen this parameter? I understand there is obvious welfare issue, but could you comment on how interesting and useful is it?
Yes. So you need to know that we had to choose a clinical parameter to evaluate the efficacy of the anti-inflammatory. So, and this parameter, the best one, is the temperature, because this is a reflection of the inflammation, I would say, in general. So this is the reason that we have chosen the temperature as variable. Now, that was also the clinical parameter that enables to compare Resflor to Nuflor and to show this action of the anti-inflammatory. But the anti-inflammatory impact is not only against the temperature, but this is the inflammation in general. So it will reduce, for example, the lung lesions that will be developed if you do not treat with the anti-inflammatory. So that was the scope of choosing the rectal temperature. And obviously, you have seen also that the drop of the temperature is for the 6 hours, okay? But Nuflor can act also because it will treat the bacterial disease. And if I didn't note it, but if you go to see at day 1 or day 2, the temperature will be at the same level than the calf treated with respiratory. But obviously, the animal will be in a better condition quicker by treating with respiratory than Nuflor, because you have this anti-inflammatory action that acts from the beginning of the treatment.
Okay, thank you very much. I'm afraid there's no time for more questions in relation to this paper. We're going to be short of time for questions throughout the session, I suspect, but I think all the speakers will probably be here at lunch, so I would suggest if you want to, you talk to them then. Thank you very much.
Thank you.